Hi, everybody. Thank you for the couple minutes wait. I will get us underway. Thank you for joining this fifth and final in our series of the PMNCH Partners Virtual Forum. And today we're talking about PMNCH, the partnership, and why partnership through PMNCH. And the team organizing this series of webinars, we haven't had a webinar orientation of PMNCH before, and so today we hope that you walk away with a better understanding of the purpose of PMNCH, the goals of the partnership over the next few years, and some concrete examples of how the PMNCH partnership, your partnership within PMNCH, will help you work towards not only your goals, but how our global community is working towards global goals for every woman and every child. Just a few announcements and housekeeping items before we get underway. I have our friend and colleague, Christy Urich, is helping with technical issues and getting everybody connected. So thank you, Christy, for that. You will have noted that as you logged in to this webinar, you were automatically put on mute. As you can see, we have quite a large number of people joining us today, and keeping yourselves on mute will help the background noise stay to a minimum. So thank you for that. We will have a time at the end of the webinar for Q&A. While we ask you to stay on mute vocally, we don't want you to be silent. So many of you are already typing in your names and where you're calling from, and that is great. But I see many of you are doing it privately to me, so don't forget to hit the send to and change it to everyone. We want you to use this chat box to ask your questions, make your comments, and interact with one another. And as the speakers are presenting, go ahead and type your questions in the chat box. We will be monitoring the chat box for your questions, and when we get to our discussion and Q&A time, we will start with the questions presented in the chat box first. I am now going to hand it over to my partner and friend here on this virtual partners forum to talk a little bit about what we're doing here and overall for the virtual partners forum. So Sheila, I'm handing this over to you.
Thanks, Good morning, good afternoon, good evening to everyone. Thank you for being with us today. I'll just say a few words about the Virtual Partners Forum, just to give you a sense of what's been going on and what's happening. Hopefully by now you're well aware that there will be a Partners Forum in Delhi next week on the 12th and 13th of December. And in anticipation of this event, and also as part alongside of the Partners Forum, we have been organizing a number of virtual events so that we can get ourselves warmed up for the conversations that will be happening in Delhi, but also for those of you that are not able to join us in person, that you have an opportunity to engage with us from afar. So there are two things that are happening in the lead up, and there are two things that will be happening alongside the forum. The ones in the lead up are the webinar series and the virtual side events. The two happening alongside the forum are the live streaming and the Meet the Panelists. You can find out more information about all of these at partnersforum2018.com. Just look for virtual forum and all the information's there. I do want to encourage you to take a look at the virtual side events. This is an opportunity for you to propose an event and to organize something between now and the end of the forum. And it can be really anything that you want to do to get a conversation going, to get a message out there. It could be an Instagram takeover, a webinar, a Twitter feed that you want to do, anything that you want to do online to keep the message and keep the movement going forward. And you'll find all the instructions on the website on how to go about that and exactly how to share that information so we can help promote that for you. As you know, this is part of the webinar series. We have now had 5 webinars as part of the webinar series. The first 4 were all aligned with the themes of the Partners Forum, so multi-sectoral collaborations, accountability, power of partnership, and political leadership. Each of the webinars were organized by the co-chairs that are developing the program for their theme at the Partners Forum, and each of them touched on an aspect of what will be covered in Delhi. If you missed any of those webinars, you can find all of the recordings on the Partners Forum website, partnersforum2018.com. Look for virtual forum, look for webinar series, and you'll find all the summaries of the webinars, the resources that were shared, the slide presentations, and the recordings all there. Same for the one today that will be up in a few days. So do feel free to go back and go back to the ones that you missed or the ones that you want to watch again. We want to say a really big thank you to World Vision International for being our partner for the webinar series and truly walking hand in hand with us as we conceptualized what this forum would be, and also right through to the execution of all the troubleshooting and the technical difficulties. And truly, as Sarah said, we have gone from being colleagues to being friends as part of this and truly working as partners side by side. So that is the theme today. What is partnership, and what does partnership for maternal, newborn, and child health really mean? What has it been doing? What is it going to be doing? And how can you get involved? That's where we're headed today. So we are thrilled to bring to you 3 speakers who have all been involved in PMNCH in one way or another for many, many years now. We're going to have a chance to hear from each of them in turn. Anne and Helga will give us sort of the big picture of what drove the development of PMNCH, what has been some of its history. Helga will take us more into where are we going, and then we'll have a chance to hear from all 3 of them to share their perspectives on what they have gained from being part of the partnership. So before I hand over, I'll just say a few more words about each of the speakers, just to give you a bit of context of who are the people that have been involved. And these are 3 of over 1,000 members. So truly, this is just a snapshot into what can happen as part of a partnership. So let me begin with Anne. Anne is widely recognized as an expert in and advocate for gender equality, women's rights, and reproductive and maternal health. She currently serves as the co-chair of the Guttmacher Lancet Commission for Sexual and Reproductive Health and Rights. From August 2014 to October 2018, she served as the president and CEO of the Guttmacher Institute, a leading research and policy organization dedicated to sexual and reproductive health, which was an organizational recipient of the United Nations Population Award in 2018. Prior to joining Guttmacher, Ms. Stars was president of Family Care International, a non-governmental organization working to improve reproductive, maternal, and newborn health in low-income countries, which she helped found in 1986. You'll hear a bit more about Anne's story as she transitioned from the Family Care International to becoming the co-chair of the PMNCH from 2005 to 2011. Next, we will have Helga Fogstad, who is our Executive Director for the PMNCH Secretariat. Helga has over 30 years of experience working in public health, working in developing countries at subnational and national levels, as well as international levels within multilateral and bilateral agencies. Prior to joining the partnership, Ms. Fogstad was the director of the Department of Global Health, Education and Research at the Norwegian Agency for Development Cooperation. She has also been responsible for NORAD's portfolio on global health and was responsible for providing technical and strategic advice to Norway's efforts in strengthening and accelerating coordinated action at global, regional, and national levels to promote rapid scale-up of proven cost-effective interventions with a special focus on the health MDGs with women and children in the center. She has a number of different experiences in forging partnerships and consensus building. All of that experience she brings to her role today as the Executive Director for the partnership. And lastly, we will hear from Gigi, who is I should say the full name first, Gungadjan Faladi, who goes by Gigi, who is the founder and executive director of the Gungadjan Faladi Pillar of Hope organization. She is a philanthropist and a development practitioner from Botswana. Her organization is a member of the UNFPA African Youth and Adolescent Network. And Gigi, in her capacity with PMNCH, has been leading the adolescent and youth constituency and will share with us some of the things that this constituency has done and ways that partners or other members might be interested in getting involved. So with that, I will hand over to Anne to take us through some of the history of how we came to be the PMNCH.
Great. Thank you very much, Sarah and Sheila. It's a pleasure to be with all of you today. or tonight or whatever the time zone it may be, wherever you are. So it's my pleasure to start us off with a quick overview of PMNCH, its history, how it's structured, its objectives, and how it works. So starting off, PMNCH was launched in September 2005. It has a secretariat, as I think you've all figured out, that's based at the World Health Organization in Geneva. What not everybody may be aware of is that PMNCH actually resulted from the merger of 3 pre-existing partnerships. There was a partnership for safe motherhood and newborn health, which had in fact previously been the Safe Motherhood Interagency Group, and that was hosted by my organization at the time, Family Care International. There was the Healthy Newborn Partnership that was hosted by Save the Children US, and there was the Child Survival Partnership, which was hosted by UNICEF. These 3 partnerships were all working in the same space, going in many cases to the same donors, to the same UN agencies for funding, for membership in boards, et cetera, et cetera. And a number of those donors got together and basically said, folks, you're all working on interlinked issues. Why don't you actually link? And so there was a negotiation process, and then the 3 partnerships came together to form PMNCH. So the aim was obviously to reduce duplication, but the overarching aim was to bring greater cohesion, coherence, and complementarity to the efforts of these different entities to promote what were then MDGs 4 and 5 on improving maternal health and reducing child mortality. So that's the brief history, and I'll get into that a little bit more in my testimonial, where I'm going to talk a little bit about some of those early years on the PMNCH board. I think it's important to remember again, or to know, that the PMNCH's initial focus was very much on MDGs 4 and 5. It was on maternal, newborn, and child health. It was not, at that time, the broader, what we now call life course approach that incorporates sexual and reproductive health, adolescent health, nutrition. Those issues were, mentioned occasionally, but kind of in passing in those first few years of PMNCH. And the focus of what PMNCH was doing was very much, it had a significant external focus, which was around raising awareness of the issues, of the importance of MDGs 4 and 5. So there was a lot of focus on working with donors, on working with governments, with ministers, with heads of state when we could get to them, with other key entities like the Global Fund and Gavi, and working with, for example, Canada on the design and implementation of the Muskoka Initiative, working with Sarah Brown, who was then the wife of the Prime Minister in the UK, and who was very committed to maternal health, to raise her understanding and awareness of PMNCH and of the broader continuum of care. There was also substantial internal work going on. There was a lot of analytical work in collaboration with academic institutions, UN agencies, to understand the full scope of the problem that we were facing. Why was maternal, newborn, and child health rates stalling or not improving as fast as they should be? What were the key interventions that could address these problems? And what were the linkages across the maternal, newborn, and child health continuum? Really trying to get concrete data and more nuanced understanding of some of those issues. There was also a lot of work on defining indicators and targets for these sets of issues. So that's a brief, very brief overview of some of those early years of PMNCH's history. In 2010, PMNCH really, I think, came into its own when it helped write the global strategy for women's and children's health, as it was at that time, which was a special initiative of Ban Ki-moon, the UN Secretary General at the time. And PMNCH played a huge role in convening the constituencies, which were 6 at that time, to come together and pool their knowledge, their information, their resources, their writing skills to actually co-write the global strategy. PMNCH, as I think we'll be hearing about a little bit later, actually facilitated a consultation that reached out to what was then the full membership of PMNCH to get their input on the draft, to get their comments and their thoughts. Similarly, in 2015, PMNCH facilitated the development of the updated or new global strategy, which was then for women's, children's, and adolescents' health and well-being. And again, although the partnership was much larger at that time, facilitated a process using online forums, in-person consultations, et cetera, to understand what were the priorities, what were the recommendations, what was the knowledge that different members of the partnership had and could contribute to the development of forging this consensus, forging this action plan for women's, children's, and adolescents' health globally. So those are just a couple of examples. PMNCH is now positioned very much as, in some ways, the partnership in support of the Every Woman, Every Child initiative, which was the movement that the global strategy is essentially the guidance document for. So PMNCH works closely with the Secretary General's office, with the other core partners in the EWEC architecture, such as the Global Financing Facility, and with a range of other partners to ensure that now in the era of the Sustainable Development Goals, that we maintain a strong focus on the need for action, policy, funding, attention, commitment to women's, children's, and adolescents' health. So very briefly, as of December of this year, there are over 1,000, I think specifically 1,040 members in PMNCH from 192 countries and across 10 constituencies. There we go. Sorry, this slide shows the growth of PMNCH's membership from the period 2009 to 2018. So as you can see, it's been quite rapid and quite significant. And it is, I'll be talking about this a little bit when we talk about the governance. It's challenging to try and fully engage such a large number of members, and PMNCH, when Helga joins us, I hope she'll be able to talk a little bit about some of the new efforts, new technologies, and new ideas that PMNCH is working on to try and engage members more effectively and more fully. So each of the 10 constituencies in PMNCH has a chair, an organizational chair from among its members. Every constituency has a member and an alternate. And because the constituencies vary so much in size, we have the Global Financing Mechanisms constituency, which is really, I think, just 3 members. And then we have the NGOs, which is the largest, which I think has probably upwards of 500 members. So obviously you have to have very different mechanisms for communication and consultation and engagement across those constituencies. So we can't really generalize about what they do. Some of them use teleconferences, some of them use email, some of them use other mechanisms. And as I said, there's still some innovative thinking going on about how best to engage, in particular, some of the larger constituencies. Constituencies are represented on the PMNCH board and its committees. Every constituency is represented on the standing committees, which are the Executive Committee, the Strategy and Finance Committee, and the Governance and Nominations Committee, which I chair. And then there are a range of more ad hoc working groups that any member can engage in. And those work on different issues. For example, there are working groups on the different thematic priorities that we hope Helga will be talking about, such as early childhood development, sexual and reproductive health and rights, etc. There are working groups for short-term tasks, such as looking at better alignment between PMNCH and EWEC. There are working groups for events, such as the Partners Forum. There's a program advocacy and committees, subcommittee, and communications, subcommittee. And then there are working groups for specific activities, such as a technical working group on tracking ODA and domestic financing for women's, children's, and adolescents' health. So there are a range of different working groups, and I'm sure that Sheila or Sarah or somebody will put up on the chat a link to the PMNCH business plan, which has just been approved, and the annex to that plan lists, in fact, all the working groups. If you're interested in learning more about any of them, then please do contact the Secretariat, which can share more information about what that working group or task team is doing, and if you're interested in getting engaged, help provide guidance on that process. As just implied by what I've said, the PMNCH Secretariat facilitates the communication and engagement for the constituencies, and it manages the implementation of the PMNCH work plan and budget. And it does if I may say, a fantastic job on that. I've never seen a harder working team of people. So this slide lists the 10 constituencies which are currently part of PMNCH. I'm going to maybe confuse you a little bit, but go first through the members of the constituencies that have been members of PMNCH from the beginning, which is the academic research and training institutes, the donors and foundations, the non-governmental organizations, partner governments, multilateral agencies. So those were the mechanisms, the constituencies that have been part of PMNCH from the beginning. The more recent additions were adolescents and youth, which joined, I believe it was in Gigi will be able to remind us, but I think it was in 2013 or 2014. The global financing mechanisms joined more recently, and the intergovernmental organizations also joined more recently. The private sector also was not part of the original lineup, but did join a number of years ago. So those are the 10 constituencies. This next slide shows visually how the different constituencies come together and are different cogs in the wheel that keeps PMNCH going, that is really in many ways the heart of PMNCH's work, as we'll be talking about, I will be talking about a little bit, and as Helga I think will be talking about more. This partnership, this engagement of partnership and of the partners, and the added value of working together in partnership is the heart of what PMNCH does and what it contributes to the field. Okay, here we go. So the PMNCH's vision and mission is up on the screen. The vision is that PMNCH works towards is that of the Every Woman, Every Child movement and the global strategy, a world in which every woman, child, and adolescent in stable, fragile, and in humanitarian crisis settings realizes their right to physical and mental health and well-being, has social and economic opportunities, and is able to participate fully in shaping prosperous and sustainable societies. So I think that vision statement is important, and as you can probably tell, was carefully crafted to reflect, of course, both the issues around mortality, around survival, and health that were and still are in many ways at the core of what PMNCH does, but it also is reflecting the broader issues, mental health, and the broader mandate of enabling women, children, adolescents, and families to achieve their full potential, to get the education, to have the equality, have the access to resources that are essential to that full engagement, to that full participation. And so while health remains the core in many ways of what PMNCH's vision and aims are, there's a very clear and strong recognition that those broader contextual issues, the contributing factors, are essential also to achieving the health and well-being of women and children, and that in fact enabling progress on those determining factors is crucial to advancements in health and survival as well. PMNCH's mission, and we'll be talking about this a little bit more in a couple of minutes as well, is focused on the additionality of PMNCH in increasing the engagement, the alignment, the accountability of partners by serving as this multi-stakeholder platform to support successful implementation of the global strategy. And this line about enabling partners to achieve more together than any individual partner could do alone is really critical to PMNCH's value added. PMNCH recognizes and is built around the fact that bringing different partners together within and across constituencies strengthens the quality of the analytical work, it strengthens the impact of the advocacy voice, it helps ensure and promote effective collaboration in countries, across countries, and at the global level. So PMNCH's main value added is to enable and to facilitate that enhancement, that strengthening of these kinds of partnerships and these kinds of collaborations. The focus of PMNCH's work, and again Helga's presentation will go into this in a little bit more detail, is the deployment of its core functions of what we call the 4A's. So it's alignment, bringing the members of the partnership together around key messages and key goals. It's analysis, serving as a platform for synthesizing and disseminating key knowledge more effectively. It's accountability, ensuring that commitments and promises that are made around the aims of improving women's, children's, and adolescents' health are tracked and monitored, and advocacy. And that's been one of the main functions of PMNCH, is to raise awareness, to mobilize commitments, financial and other, in support of the Survive, Thrive, and Transform targets of the global strategy. The graphic here on the bottom part of this slide illustrates what we call the life course approach to health and sustainable development, to women's, children's, and adolescents' health. And I won't go into it in detail, but what this illustrates is the recognition that progress at different stages of life are very much interrelated. Women's health before pregnancy, during pregnancy, after pregnancy, has a significant impact on the health of her newborns and her children. The health and well-being of newborns and children affects their health and well-being as adolescents and later in life. And we recognize these factors, and also therefore recognize that the services and interventions that need to be provided to people across these different phases of their life also need to be interconnected and related. I think this is my final slide, just a little bit around the mandate of the PMNCH board. It really falls into two core dimensions. First is support for the EWEC movement and the PMNCH community. So that's the role of the PMNCH board, as giving voice to the different constituencies across the women's, children's, and adolescents' health continuum or life course, and providing a space, a platform, a mechanism to achieve consensus and cohesion. So if any of you have ever been to board meetings, or if you're going to come to the board meeting, you'll see that in action. It's sometimes a challenging process, but it's always a very productive one that really increases understanding and cohesion across the different members and across the different constituencies. The second core function of the PMNCH board is a governance one. So it oversees the implementation of the PMNCH business plan, work plan, and budget, but it also, at the higher level, really is responsible for articulating a vision and approving the strategic directions and priorities for PMNCH that's based on these very different views, the different geographic scope that PMNCH partners work in, and the different needs that they see. I think that's it for me. So Sarah, back over to you. I hope Helga's joined us while I've been talking.
He has joined us. Helga, one moment, and I will get you the presenter ball. There you go, Helga. You are muted, and now presenter. Begin as you are ready.
Thank you. I was waiting for the X to vanish. So thank you very much. I'm Helga Foxton, I'm the Executive Director of the partnership, and I'm really happy to be here with you all and to present on really the 2018-2020 business plan, which has just newly been approved by the Executive Committee on behalf of the board. So my presentation will then, following Anne's presentation, I will hone in on the PMNCH value proposition, the business plan context, our theory of change, and delivering and the methods that we have then really looked into of delivering the business plan, and so which includes then the partner engagement. So our PMNCH functions, like Anne has said, has very much on the 4A's. We look at looking at analysis as being what are the areas that we need to look into better in order to prepare ourselves as a community to really drive change for women, children, and adolescent health. This has been in the past investment case for health, investment case for women, children, adolescent health. It has been the investment case for Africa or the investment case for Asia as it relates for our area. Then there is also the alignment, which really consists of how to bring different constituencies more powerfully together in order to implement the global strategy objectives and goals, and to do more together than alone. The other aspect of the partnership is really on advocacy, so looking at how we can powerfully advocate in order to really then drive change. The fourth aspect is accountability, which is really has been an increasing area of focus of not only monitoring but also better reviewing better data, knowing how to deep dive into areas that need more focus, to be looked in more critically, and also then to find platforms in order to then dialogue about these analyses in order to drive change. And so that is very really something that PMNCH has spent more time in the last part of years in order to do that better. We also host the Independent Accountability Panel, which reports to the high-level steering group of the UN Secretary General of the EVEC, of the Every Woman, Every Child movement. Anne has really covered this. What the next slide is, it's the architecture of the Every Woman, Every Child movement in regards to the key partners. You see that there is the high-level steering group there. The Every Woman, Every Child UN Secretary General's function is to being a senior co-chair of the group. It used to be President Bachelet from Chile, and then the Prime Minister of Ethiopia. There is a changing of guards recently to the President of Estonia, and I think that they are still have not finally placed the next co-chair, which we expect to then happen before their next meeting in April. So the architecture really covers the H6, which is the UN agencies relevant for women, children, adolescent health, and also development partners in providing technical assistance. It is the financing for women's and children and adolescent health, which includes not only the Global Financing Facility, but also Gavi, the Global Fund. And then it's our role in PMNCH in order to do really honing in on advocacy, alignment, and accountability. We're using the rich platform of our 10 different constituencies, each one playing its important part. So this is really in how we collaborate and also how we come together. Key achievements of the past have been in when we're developing the global strategy. As Anne said, there was really 3 different partnerships, but there were even more disagreement and piecemeal efforts among partners within constituencies and between constituencies. So there was very little alignment before, and this really increased very nicely with the effort of agreeing to align behind a common global strategy. So the first one was developed in 2010 to 2015, and if you see the achievements of that in regards to the rate of acceleration in reducing maternal and also child mortality, our efforts really were paid off because there was much more of a concerted and accelerated effort which was needed. In starting the next version of the global strategy for 2016 and 2030, which then really focuses on the SDG era. One of the things that PMNCH did was in in developing this document, we did the consultation process, which included inputs from 7,000 organizations around the world that inputted, that first of all were drawn in order to be a part of this global strategy, but also to feed into it so that there is ownership in implementing it. So the other thing is to really agree on member states and to use the structures that exist for governments, so both the UN General Assembly as well as the World Health Assembly. The other thing that was done was securing resolutions and support and for all women and children health by the 140 parliamentarians of the IPU, the Interparliamentarian Union. We a lot of the efforts that were done as a part of the global strategy. We also monitor and track progress of the 45 billion of commitments and over 650 partners that did commit to the global strategy, and also provide accountability for their delivery. So we do coordinate the progress reporting of the global strategy. So there is really no other partnership that has the breadth and depth and diversity of PMNCH that covers women, children, adolescents, health and well-being. Here you see in this slide the business plan within the SDG and the Every Woman, Every Child framework that was approved by the high-level steering group. And this one then shows how the global strategy really underlines the SDGs. The global strategy, there is 60 indicators which our partners help in monitoring, of which 34 of them are SDG indicators, and 26 are additional global strategy or global agreements of global frameworks in specific areas which our community has found important to be focusing on. We then also look at the strategic plan, which is 5 years period, and we have then developed two business plans, one for 2016 to 2018, and then a new one that has newly been approved for 2018 to 2020. They're a little different in format and structure. The current one really focuses on the 6 focus areas of the Every Woman, Every Child, as well as the shared deliverables. So organizing the objectives and outcomes, we have a theory of change that articulates how our actions are going to contribute to the 6 focus areas. The 6 focus areas are early childhood development, adolescent health and well-being, quality, equity, dignity, and sexual reproductive health and rights, and then empowerment of women, girls, and communities, and then humanitarian fragile settings. And the next slide will show you the summary of theory of change, which really nicely indicates how our purple areas, which is our outcomes and with our key outcomes, how they then are synchronized, but also contribute to the Every Woman, Every Child results framework. That is what you have at the top, which is reflected in white. So this is the correlation of how we see it and our part in the EVEC architecture. So delivering on the business plan, which is something that we have focused on in understanding what is our added value and how do we need to best deliver on it, we have then found out that we need to spend more time in understanding how to be more partnership-centric and achieve more than alone. And we have been looking at ways of using more our website to reaching because when we started, we were only 50 members, and now we're about we're really above 1,000. So this is really another ball game altogether for us. So we need to see mechanisms in really being able to not only reach, but dialogue and engage better and more effectively with all of our partners. So this is important to ensure that we are really nimble, and yet we are powerful as a partnership. The country-based work has really to look at more promoting inclusive and meaningful multi-stakeholder engagement, and strengthening, aligning accountability processes, and enhancing multi-stakeholder linkages, supporting and joint advocacy, as well as facilitating learning and exchanging across countries. So what we're focusing on the country level is really strengthening the multi-stakeholder platform to looking at more of the ensuring that constituency groups that have not been really engaged at that level have much more of a seat, are much more engaged, are much more included, and to ensure that all constituencies are a part of not only developing but implementing, as well as monitoring and discussing and reviewing these national priority plans, which in our case we try to really hone in on ensuring are focused on women, children, and adolescents. Equity, quality, and rights have been a key. So these are areas that were in the MDGs have been very much lagging, which have been then a focus in our time and effort. I think this is my last slide. PMCH then has organized itself in working with in working groups and committees. Some of these working groups are ad hoc, others are more long-term, and they are designed more for fit for purpose in order to then meet what we need to come together in order to resolve both thematically or function related, or aimed at governing PMNCH's and its operation. So I think this was a bit race, but I hope you have we've been able to give you a somewhat of a snapshot of how PMNCH, not only what we focus on, but how we work and how we try to deliver on working better together in order to reach more together than alone. Thank you. Over to you, Sarah or Sheila.
Hi again, everyone. Thank you to Anne and Helga for that big picture overview of the past and present and future of PMNCH. We're going to turn our attention now to some testimonials. I'm sure you're wondering, okay, what does this all mean in reality? What are some really concrete things that have happened over the years? And we're hoping that these testimonials will inspire you to think about ways that you might want to get involved, either with what you're already doing or an idea you have that you might want to suggest for the future. So we will hear from Gigi first, then Anne, then Helga. They'll each go in turn, and they'll share with us why they got involved with PMNCH, how participation in PMNCH, how being a member has helped them advance their goals or their objectives of their organizations. And lastly, we will hear how their contribution to PMNCH has helped advance the work of the constituency that they were involved in. So start thinking about your questions. You can start putting them in the chat from now or as we're going. And I'll hand over to Gigi. And then Gigi, when you're done, if you wouldn't mind just handing straight over to Anne and Anne over to Helga, and we'll just do each one in turn. Over to you, Gigi.
I actually just got a quick note from Gigi. She needs 2 minutes to reconnect her hotspot. So perhaps, Anne, can I put you on quick spot and say, we'll have Anne go first. How does that sound? And then we'll do Gigi next when her hotspot reconnects.
I just had to unmute. Sure, I'm happy to start us off with this part of the discussion. So This first slide shows the cover and the first couple of pages of PMNCH's strategy back from 2007, which was right near the beginning. I'm not going to talk to it specifically, but I just wanted to build on this visual and talk a little bit about, I think, one of the key elements of what I saw PMNCH do as it was getting going. As I think was mentioned, I was on the board from 2000, have been on a board with a brief period when I rotated off from 2005 until now in two different constituencies. I started out in the NGO constituency when I was at Family Care International, and I was co-chair for the first 6 years of PMNCH from 2005 to 2011. And I think as being in that leadership position at the very beginning of the partnership, I saw both some of the challenges that
Anne, I'm sorry to interrupt, but you are very, very quiet. Can you come closer to your mic? Several people
I'm sorry.
are sitting with. Oh, there, better. Thank you so much.
Sorry, I'm wearing headphones and I had flipped up my little speaker thing. My apologies. So anyway, sorry. Most of that was prefatory anyway. What I wanted to emphasize or talk about in this was the really important role that PMNCH played in building bridges across what were then quite disparate and often in many ways disconnected communities. I know it sounds perhaps bizarre and maybe even hard to believe at this point to say that the maternal health community, the child health community, the newborn health community really kept each other very much at arm's length when PMNCH was established. They focused on, to some extent, on different issues. They had kind of different strategic approaches, but bringing those communities together in PMNCH, working on the knowledge sharing, on the messaging, on the advocacy, did a huge amount to build understanding across this continuum of care, and to build acceptance and support for each other's key messages. You know, again, for me, coming from the maternal health side of the agenda, or the maternal health community, when PMNCH was founded, there was in some ways real concern and sometimes resistance from, for example, the child health community to the maternal health community's focus on access to safe abortion, on some of the other more controversial elements of the mandate that the maternal health community had been focusing on. And there was sometimes reluctance to engage. The focus of the maternal health community on ensuring really strong health systems and a referral system so that women who needed a cesarean section could get to a health facility and get the services they need, again, was quite different from a strong focus that the child health community at that time was concentrating on around interventions like immunization, nutrition, etc. So there was an enormous amount of effort and enormous amount of benefit from bringing these different communities together, engaging them in policy discussions, in research and evidence discussions, in strategy discussions about the importance of integrating our messages and our services and our interventions, which of course, was critical for the ultimate beneficiaries. We all know, of course, that women and children are the primary users of primary health care services, and it's important for those services, particularly I think for women, for services to be offered in an integrated and comprehensive way. So having the community reflect that integration, that interdependence across the continuum of care, I think was critical and was a critical achievement of PMNCH. The second, come on, computer. There we go. The second example that I was going to talk about was responding to this question of how has active PMNCH participation helped achieve the purpose and objectives of my organization. And here I'm going to talk about the Guttmacher Institute and the Guttmacher Lancet Commission, which launched its major report on sexual and reproductive health and rights in May of this year. Just on a sheer practical level, the PMNCH Secretariat was absolutely a core, in fact, in many ways, a leading partner for the launch event that was held in Geneva during the World Health Assembly. As you can see from this photograph here, they helped to mobilize Dr. Tedros, who came to the event and spoke strongly in support of sexual and reproductive health and rights and the recommendations in the Guttmacher Lancet Commission report. The PMNCH Secretariat organized the venue, did the invitations, really just played a huge role in getting this event organized on the ground. It was literally standing room only. We had, I think, probably a good couple of dozen people, in fact, standing in the room. So there was a huge impact and uptake. The Twitter coverage, et cetera, was really strong. And PMNCH, during World Health Assembly, which is probably one of the busiest times of the year for that entity, put a huge amount of effort into this particular event and the dissemination of this report. Now, of course, PMNCH didn't do that as a favor to Guttmacher or to the Guttmacher Lancet Commission. PMNCH did that because sexual and reproductive health and rights was one of the 6 core thematic areas. And PMNCH has continued to play a crucial role in picking up and amplifying and using the recommendations and contents from the Guttmacher Lancet Commission report. There's a stream of work around promoting SRHR as a core pillar of universal health coverage, and PMNCH has been, through the partners and through the Secretariat, playing a lead role in promoting that work, in helping to write documents, to review messaging documents, to think through the advocacy strategy for this effort. So I just wanted to highlight that where the interests and products and messaging of members really do fit into the overall PMNCH work plan and strategy, then there's a huge opportunity, and the reach of PMNCH is tremendous. So having PMNCH pick this up and help to facilitate the dissemination and promotion of the Guttmacher Lancet Commission report's findings is a huge amplification, what we sometimes call the 5th A of PMNCH's 4 A's. The last question or example that I wanted to address was this question about how has active participation in PMNCH helped the constituencies that I have represented. And as I mentioned, I've been a member initially of the NGO constituency, and then for the last 4 years was a member of the ART constituency, which are the 2 largest constituencies in PMNCH. And as I've mentioned earlier, that has presented challenges at times. When I was chairing the NGO constituency at the beginning, we could get a teleconference and have all the NGO members of the PMNCH constituency participate, or at least many of them. That's not an option, obviously, when you have probably 500 plus members in that constituency. So PMNCH has tried and worked hard to engage members actively. As I said, it hasn't always been easy. There have been things that have been tried that haven't always worked, to be honest. But that opportunity of engaging in the board, of engaging in working groups, of participating in Partners Forum, at events such as those that are held at World Health Assembly, during UN General Assembly, etc., are so valuable for both building bridges and establishing connections within the constituency, but across constituencies as well. I think PMNCH is unique among global health partnerships in having such a strong and diverse civil society membership. Civil society organizations have, I actually haven't looked at the numbers, but probably have half the seats on the board. If you look at the NGO constituency, the healthcare professionals, the academic research and training institutions, the adolescents and youth, and the intergovernmental organizations, those are a significant point. Each of those has its own constituency in PMNCH, whereas in most global health partnerships like the Global Fund or Gavi, there is a single constituency for all civil society entities. So I think it's really important and a reflection of the value and the importance that PMNCH places in that civil society voice and that civil society membership. That said, there is also the strong voice and the strong participation of the multilateral agencies, of the donors and foundations, of the partner governments, and of the private sector as well. And building those bridges and providing that opportunity for exchange and understanding across these constituencies has been incredibly valuable, I think, for the different constituencies, both as individuals and as constituencies. So I'll wrap that up there and toss it back to Sarah and hope that Gigi's hotspot problems have been solved by now.
I think they have. Thank you, Anne. And I know, Anne, as I'm toggling over to Gigi's line to unmute her, I know that Anne and Helga are all looking forward to your questions. So please use our chat box to ask those questions. Oh. Gigi? Hold on, I'm checking to see if I can unmute you. Oh, you're open.
Yeah,
Start if you're ready, Gigi.
Yes, I've already unmuted. Thank you. Sorry about that. We had a power cut, so now I'm hotspotting from my phone. So I hope the internet is not so bad. To share testimony about how I got involved with PMNCH, but also some testimonies from the adolescent and youth constituency. So I am from Botswana, as I think Sarah or Sheila said when they were introducing us. And a couple of you might be aware that a little over a decade ago, Botswana had the dubious distinction of having the highest HIV and AIDS prevalence rate in the whole world. And at that time, I was in school, and I remember just watching on TV, the president at that time was making a nationwide appeal for people to help in the HIV and AIDS response, but mostly by helping those who have been infected and affected. So when I started my organization, the Pillar of Hope Project, it was mainly meant to focus on philanthropy or humanitarian work, helping orphans and vulnerable children who've been affected by HIV and AIDS and lost parents. And what we'll do is that we'd give them food, would give them clothing, help them financially in other ways. But at the same time, raising awareness around eradicating the stigma that is attached to HIV and AIDS, and of course promoting responsible sexual behaviors among people in my country. So that is the basis of starting my organization, and then over time we transitioned into human rights advocacy, and we tend to focus more on issues that affect women, children, adolescents and young people, mainly because my country is one of the countries that have the highest gender-based violence prevalence or incidences. So we drew a nexus between the prevalence of HIV and AIDS as well as its correlation to gender-based violence prevalence. So we started doing outreaches, advocacy, civic education, raising awareness using multimedia platforms, engaging various leaders in community to be able to amplify our messages, especially around health issues, because health is very, very important, but also in the context of Africa, it tends to be a very controversial issues, especially when we talk about issues of sexual reproductive health and rights. So my organization is part of the African Youth and Adolescent Network on Population and Development, AFRIAN, and for some time I was leading on the Demographic Dividend thematic subcommittee. So when I first came across PMNCH, it was in 2015 around the global strategy consultations when the revised global strategy on women's and adolescent health was being developed, and I was part of the young people who were part of the consultations in South Africa for the Africa region. And at that time, PMNCH was working on a adolescent and youth engagement strategy, but the chair was Mama Gracia Michelle, who is such a proponent of meaningful youth engagement, and through her influence as the chair of the PMNCH, she really pushed for PMNCH board to endorse having a stand-alone constituency that will focus on adolescents and young people, saying that it's not enough to just mainstream and widen into all the other constituencies, the work of the partnership, but it would be really important that we have a standalone constituency as well that could lead on delivering on the welfare and well-being of adolescents and young people at different levels. So that is how the constituency came to be earlier on. And was asking about when the AYC was formally recognized as a constituency. So that was in 2015. That's when we got to be recognized, and we got 2 board seats that are currently led by myself and my colleague Tikala from Malawi, and then we have 2 other AY leaders who are alternates. So being part of the partnership has been really eye-opening. It's really important that a lot of partners learn not only how to deliver or work for young people, but also how to work with young people. And I think being part of the partnership, the fact that it brings together so many stakeholders from all over the world in different spheres of influence that work in the continuum of care or in women, children, and adolescent health, has really given us a unique opportunity to be able to share best practices on how to go about meaningful youth engagement, how to engage with young people in decision making, what interventions work, and how can we tailor them to adolescent and youth networks and organizations across the world. So it has been that great opportunity, and I think to a large extent PMNCH has provided a template for many partners, for many organizations across the world on how to meaningfully and effectively engage adolescents and young people. One of the things I will say is that, so it's, I think the camera is not on mute, so I can hear some background noise. Please put yourself on mute. So what we do as a constituency is that we are the ones that will be leading on, but also contributing to the broader adolescent health and well-being portfolio of the Partnership for Maternal, Newborn, and Child Health. So this adolescent and health well-being portfolio has 3 main pillars that are guiding the deliverables. The first one is evidence for action, which focuses on promoting and synthesizing new adolescent and youth research findings for action and results. The second one on the ability to measure the tools they need to be agents of change. And then the last one is scaling up adolescent and youth action for social change, which focuses on enabling youth-led advocacy and accountability to drive social change. So I'm going to share with you some of the milestones or initiatives in the manner of testimonials that we've received from some of our members who have actively taken part in some of the activities we had under each pillar. So for example, under the first pillar for evidence for action, one of the things that we had our members meaningfully engaged in was on designing the knowledge summary now for adolescents, and this has been popularized during different high-level meetings, such as during the Women Deliver Conference in Denmark and even during the IPU assembly that was held in 2017 in Dhaka with over 1,000 parliamentarians from all over the world. And this summary basically raises awareness on the priority issues facing adolescents with virtual dissemination and presentation at so it focuses on various issues that are facing adolescents and young people, and also on how best to engage ANY at different levels. Another important tool that we developed or we worked on as a constituency is the AHA framework. This is the Accelerated Action for Health Among Adolescents framework by the WHO. We had 5 of our AYC members involved in the advisory committee designing the AHA framework. We also had AYC members that were contracted by WHO to translate to 10 to 14 years old. And at the regional level in Africa, the WHO Afro office actually trained almost 10 youth activists and experts from the AYC to be trained to help countries that would want support in implementing this country guidance on how to invest in health and development and well-being of young people from various ministries. So that is an example of how we've had AYC members engaged under this pillar. Now moving on to the next one very quickly, empowerment and accountability pillar. We've had one of our big flagship programs would be the AY mentorship program. And this is where constituency members of the PMNCH from various constituencies were asked to kindly adopt a mentee or adopt a maximum of 2 mentees from the adolescent and youth constituency. And then the mentor and mentee decide on the terms and the conditions of the mentorship and how often or how frequent they will conduct the virtual mentorship program. And we've had some great testimonies from young people. When you look at that slide from the top left side, you'll see Don Mutua. He's from Kenya and he's with Dance for Life, and he's right there with his mentor. They met just as a coincidence during a conference on MNCH that was held in Nairobi. So we've had mentors and mentees being able to really share really great experiences as development practitioners working in different sectors. And then others have had opportunities to actually meet in person. And we're hoping that with the upcoming Partners Forum, we can have more mentors finally getting to have an in-person meetup with their mentee. And this is another initiative that we're going to do a SWOT analysis on at the very end of the year, and then see how now we can really amplify it or better enhance it towards the end of the year. Another important one is the Advocating for Change for Adolescent Toolkit that was developed in partnership with Women Deliver. And basically the point of this toolkit is to encourage the meaningful engagement of youth and to drive positive advocacy and accountability efforts to influence national health plans and policy processes. We offered seed grants to 5 youth organizations and networks to work on the rollout of the toolkit in the first year, and that was youth organizations from Malawi, Cameroon, Nigeria, Kenya, and India, and they've been doing really amazing work. The center picture there is Zanele from South Africa holding up the advocacy toolkit, who has been the focal person for this. So with the toolkit, we've been able to also popularize it beyond the 5 countries in many different conferences that we've had, such as ICFP, as well as providing guidelines on how young activists and advocates at country level can actually use this as a tool to meaningfully engage with their leaders and actually have tangible outputs from such engagements. So that is one such way. One of the things we're doing is that we try to leverage on the partner-centric approach to ensure that in the next year, we won't be giving seed grants to the same countries again. But since the partnership has so many members, and some of the members that are in PMNCH are also present, they have offices in some of the grantee countries. So what we're doing is that we're trying to link the youth activists, NGOs that benefited from the toolkit grant to local or in-country PMNCH partners to see if they can be able to support them in the following year in some of the actions they will be taking with regards to the toolkit and some of the initiatives that these organizations may wish to embark on in the next year. Maybe, for example, maybe translating the advocacy toolkit into a local language or so on and so forth. So we're hoping that the partner-centric approach of the PMNCH will be beneficial to the young people. The top right picture is of Testimonials from Cameroon having a consultation with youth networks in Cameroon on the advocacy toolkit. Now, I'm going to go, we've done also a lot of work on accountability, and this is very important for me to mention because, as you know, that we had the 2017 Independent Accountability Panel report that was launched at the UN General Assembly in 2017. It had the focus was on transforming accountability for adolescents, and it had really 6 brilliant recommendations on what should be done to invest in the well-being of adolescents. So we have also, as AYC, taken it as on board as our mandate to really popularize these 6 recommendations during our country engagements, but also during global meetings whenever we have AYC representatives at those meetings, or when AYC members have opportunities to speak at panels and so on and so forth. They do reference the 6 recommendations from the IAP report. Now, moving to the last pillar, which is on scaling up A and Y action to drive social change. Now, this is very important for us because one thing we do is that PMNCH provides small grants to adolescent and youth-led organizations and members to scale up social change. And these may be youth organizations, movements, and networks that work on coalition building, to have more cohesive and unified movements at country level to drive youth-led advocacy, as well as accountability, because accountability in this line of work is very, very important. So in the next coming years, we would be doing projects where we are going to build the capacity of a chosen youth network to strengthen national coalitions for youth-led accountability for women's, children, and adolescent health. And we're going to be working with a bit more countries than the ones that benefited from the advocacy toolkit. But also, when you talk about social change, this includes strengthening of multi-stakeholder national platforms that ensure meaningful engagement of adolescents and youth to advance policies on adolescent and young people's health, as well as building multi-sectoral country-specific campaigns to improve adolescent and youth health and well-being. So this is some of the things we'll be focusing on doing in the next coming year. A great example of that, because we already have a template that we're going to be using and maybe learning from to see how we are going to best or more effectively roll this out in other countries. And that a template we have is that last year in Malawi, we had a Strengthening Adolescent and Youth Coalition meeting just before the PMNCH board meeting, and that was a really great meeting that we had, and we had a focal person from AYC who managed to mobilize many youth networks and youth organizations from across Malawi to come together and to close the gaps in terms of messaging, advocacy, interventions, and so on and so forth. Because one thing we cannot deny, as much as it's a cliche, is that there is really strength in numbers. So our biggest power as adolescents and young people is our demographic weight, and we need to be able to harness it and leverage it to advocate for change for the well-being of adolescents and young people. So I think those are the key testimonials, experiences we've had in the past year since 2015 of the adolescent and youth constituency. And maybe just to end off by saying that if you're coming from a different country, organization, region, and you know of adolescent and youth organizations, networks, or movements that would benefit from being part of the AYC, please go to the PMNCH website and go to the tab where you can apply for membership. Go to the Adolescent and Youth Constituency. I see Sheila just shared the link there, and please ask them to apply for membership of this amazing and the only population-based constituency of the PMNCH. I'll stop there. Thank you very much.
Thank you so much, Gigi. What a wonderful presentation, and gives everybody a good example as to how to get started by doing that joining. We have one more testimonial, but I'm already seeing some amazing questions coming into the chat. Helga says she's going to make it a 2-minute testimonial so we can dive right into your chat questions. Thank you, Helga, for editing your experience testimonial, because I know you very much want to get into the audience's questions. So Helga, over to you.
Thank you so much. And my testimony was from the time that I was a part of the government of Norway, behind Prime Minister Stoltenberg, that was very committed to women, children, and adolescent health, and he was willing to do a global leaders network that was established, and so this was in 2007, and there was a need and recognition that more focus needed to be done on women, maternal and child health. And so what we experienced around that period is all of a sudden there mushroomed up a lot of initiative, a lot of funding, additional funding, and what we found ourselves in a situation was that there was multiple initiatives that mushroomed up. So the UK launched the International Health Partnership, Global Compact for Achieving the Health MDGs. Norway launched the Global Leaders Network for MDG 4 and 5 and 6. And then Canada launched the Canadian Catalytic Initiative to save 1 million lives, which was focusing on child health. Now, the benefit of this, of course, was that there was more focus, more resources, and there was more action. The challenge was that there was all of these silos, vertical initiatives. There was a lot of lack of coordination. There was not the recognition, the fear of not recognition of contributing and strengthening the health systems. There was very much focus on results-based financing at the expense of long-term predictable financing. And there was also more focus on ODA than there was on the role of the state and focusing on increasing domestic financing. And then there was also an issue about was this really new money or was it reallocated money? So there became really all of a sudden more focus on war on numbers than there became kind of war on the issue and really rallying and getting partners around. Now, PMNCH, we reached out from the government of Norway to PMNCH and suggested that one use the partnerships platform in order to then come together and align better around the priorities. And what was then done and agreed upon with the UN Secretary General at the time, Ban Ki-moon, was to develop a global strategy for women's and children's health and get all of the partners to really align behind it. And this was done in 2010. It was the first time that really one saw an agreement on how we approach women's and children's health. And this was very much really an effort on not only political will, but also by all constituencies in implementing. And one did see a 40 billion increase in financing, which was really important. Now, the PMNCH was really helpful in aligning partners and really using our forces more together in order to really rally, each playing our part instead of all of these silo efforts that would not have been as efficient if they had just gone on their own. So I think this is really important to then recognize that this is how PMNCH can be used on focusing on not only on the life course approach, but areas in that life course approach that need special attention, like stillbirths or like adolescents or humanitarian fragile settings. And so that is really important that those issues are then discussed and agreed upon. So that is really my testimonial. It was an excellent thing, excellent effort. It got, only, as I said earlier, the strategy itself, the consultation reached 7,000 organizations that inputted into it. This is something that, we as a country would never be able to do alone. So that was really the power of partnership, and that was it was really great. Over to you, Sarah and Sheila.
Perfect. Thank you, Helga, for giving your testimonial, and thank you to Anne and Gigi for leading us through this PMNCH orientation. We have a couple of questions that have already arrived in the chat box, and I'll dive in there. But if you still have questions you have not yet asked for our participants, please go ahead and continue to put them in the chat box. I'll continue to monitor that as we move into this discussion point. Helga, the first question that I'd like to be addressed in this time of Q&A is around funding for PMNCH. It wasn't mentioned in the first pieces of the orientation. So explain a little bit on how PMNCH is funded.
Okay, so PMNCH has a donor and foundation committee, but it reaches out to, it has a resource mobilization strategy, which we then follow and have actually approximately, I think, 15 different donors. So we have a wide donor base. Our business plan is costed at two different levels, at an essential level and a comprehensive level. So the essential level is at 10 million, and the comprehensive level is at 15 million per year. And the fundraising, it follows a resource mobilization strategy, which we then really get mobilize our efforts around. And so we are confident in that we at least reach the essential level, and that enables us also to be aligned with the board's priority setting, and that has worked well so far.
There's a question here from one of our partners who, if a partner with an idea about wanting to better promote preconception phase health and well-being, but if they're not really sure which constituency or where to go with this idea, this new idea, or where to find which of the 1,000 partners that we're in partnership with, what's the best way to get that one member connected with the right group? Where do you go for help if you're not really sure where to first engage in PMNCH?
So the easy way is to write to the PMNCH, contact us and ask that question, and we will then, from the Secretariat, really get back. However, in the future, we're trying to analyze where our partners are according to country, and what constituency they are and what they are working on, and really map this and make this available on our website, so it will be easy for each partner or a stakeholder to really take contact directly. So this is what we hope to in the future. But we do have a database that is close, and we could help with making that connectivity possible. If it is the more thematic area, then we will be guided on what work the various working groups that are present, and so just write to the website, contact us, and then we will put you in contact with that working group that works on that area or related area in regards to the either thematic or function areas of PMCH's work plan and business plan.
Thank you. And perhaps we'll pitch, as a board member, we'll pitch this question to you. And it's talking about how does PMNCH function at a country-by-country level? Have countries organized themselves with members? So talk a little bit about that.
Sure. Thanks. So there's two ways to answer that. One is, how does PMNCH organize itself at the country level, or how does PMNCH sort of at the global level engage with countries? And then there's the question of how PMNCH members across the constituencies can organize themselves within a specific country. One of the core aims of what PMNCH is doing right now, which we haven't really had time to talk about much on this call, is around supporting the Global Financing Facility and its work to work with priority countries to develop these investment cases for women's, children's, and adolescents' health. And one of the things that PMNCH is working hard with GFF and others to do is to try and ensure that for the national entity, task team, or committee, or whatever it may be, that's providing support for the development of the national investment case for women's and children's and adolescents' health, that the membership of that national entity reflects and echoes the diversity of membership, and in particular of the constituencies across PMNCH as a whole. I think those of you, which I think is a lot of you, who have worked at country level, have seen that very often kind of the decision-making bodies at country level historically have often included, obviously, the government of the country, the UN agency representatives and donors and foundations, but often has not had strong representation from civil society, from healthcare professionals, from private sector, and from some of the other, and from adolescents and youth. So one of the things that PMNCH is really promoting is the value and the importance of that multi-constituency participation in these national kinds of decision-making and policy-setting bodies. and conveying both the value of that, but also providing support in helping to ensure that that engagement and that participation is effective and well informed and constructive. In terms of engaging at the country level, again, and maybe if we have time, Helga can talk a little bit about this. That's something that PMNCH is working on. She just mentioned that PMNCH can, for example, if an organization is based in a specific country, provide contact information and identification of the other representatives from across the constituencies that are resident in that country. So to try and sort of help get that process started of working together at the country level around a specific thematic topic or around the agenda of women's and children's and adolescents' health writ large. That obviously then provides a mechanism for engaging with the partner countries as well, who are also represented in that constituency structure. I don't know if we have time, but maybe Helga can just chip in if you want to add or correct anything I've said, Helga.
Well, if I could just add that we're also supporting we're also going to support the multi-stakeholder platform in several countries, which is going to ensure that all of the different constituencies are involved in either planning or implementing or following up the priorities around women, children, and adolescent health, and that we are looking at focusing also on the framework of universal health coverage, on the Alma Ata follow-up that we had now in the fall of primary healthcare, as well as the flagship program of the World Bank and human capital. So to see a little bit about how the constituencies can come together in order to really see and follow up on country development plans, as well as implementation and accountability of them. So there will also be small grants in order to support both common advocacy as well as accountability.
Thank you all, and my apologies to the other questions that are in the chat box. We are running out of time, but I hope you will continue to engage with us during the virtual portions of the forum. Sheila, I'm going to hand it back over to you so that you can close this out and tell us where to go for more.
Wonderful. Thank you so much, Sarah. A big thank you to Anne, Helga, and Gigi for your time today, and to all of you who joined us on the line. As I said at the beginning of the call, we have a virtual partners forum where you can find more information about the past webinars. You can find out about virtual side events or organize a virtual side event. You can also join us from a distance for the live streaming of the plenary sessions and get to know some of the panelists and the participants at the forum in Delhi next week. All of that is available at the website, partnersforum2018.com. If you're looking for the recordings for the webinar series, look for virtual forum and then look for webinar series. Please do join the conversation. Keep it going. You can follow us on Twitter and Facebook. You can use the hashtag 2018 PMNCH Live. This is our last webinar series for the year for the Partners Forum, but we do hope to continue this in the new year with more conversations with all of you. So if you have ideas or suggestions of topics that would be of interest, or if you want to come forward and offer a topic that you might want to lead on for a webinar, please do send us an email. And lastly, I just want to say once again a big thank you to World Vision International for all the support and all the work hand in hand to bring this webinar series to life. So with that, I'll say thank you to Sarah, to Anne, to Helga, and to Gigi, and to all of you for being with us for this webinar series. Take care. Goodbye.
Great. Thanks to all of you.
Thanks. Bye.